Hey everybody, it's your favorite COVID communicator, Dr. Rosen. I'm here to answer your questions about the COVID vaccine. We received many excellent questions. I'm getting great questions by email. I appreciate everybody's interest and your excellent thoughts about the situation. I wanted to start by giving just a quick overview about the vaccine and the way it works, so that maybe that'll kind of answer some of the questions people have to begin with. Vaccines in general are basically given to give your body a kind of a blueprint of what to look at. So the way that someone once described it to me is if you own a restaurant and someone comes in and says, okay, tomorrow you're going to get robbed, right? If you are unprepared, you don't really know what you're looking for. But if someone comes in and says, okay, tomorrow you're going to get robbed, and here's a picture of the person that's going to rob you, now you know how to fortify your defenses and how to get yourself prepared for that. So a vaccine is to present your body with that picture and say, this is the person that's going to attack you, or this is the organism that's going to attack you. And your body looks at that picture and creates a defense mechanism against that organism. So the COVID vaccine uses a process, well, there are several processes out there, but the ones that are currently in production, the ones that are currently being offered, are mRNA vaccines. And what mRNA is, it's like a little blueprint that your body uses to create a protein. And this right here is called the spike protein, this little guy right here. So when you get a COVID mRNA vaccine, it puts this blueprint into your muscle, and your muscle uses that blueprint to create this protein right here. Not the rest of it, just the protein. And that is how COVID enters your cells and infects your body. So your body creates a defense mechanism, an antibody to that spike protein based on the mRNA. So there is no COVID in the vaccine itself. It just gives your body that ability to create antibodies to that spike protein so that when you are exposed to COVID and your body sees that spike protein for real, it knows to go ahead and attack that molecule and get rid of it. A lot of people have said, well, can you get sick from the COVID vaccine? And how come people are feeling so lousy after the second one or feeling so lousy after the first one? And the thing is that you want your body to react. The whole point is that you are giving your body this picture and you want your body to say, oh yeah, I'm gonna fortify my defenses. So how does your body create defenses? It can do that by creating antibodies. That creation can create swelling in your lymph nodes, it can create temperature elevations, it can create headaches and joint pain, and all the things you experience when you're sick is actually your body's immune system at work. So a lot of people feel pretty lousy after the vaccine because their body is doing what it's supposed to do, is creating the immune response. Not everybody feels badly, that's okay. I personally did not, but some people really did, and that's okay too. I'm going to go over in some of these great questions, what are the signs when you really shouldn't feel after the vaccine? So hopefully this gave you guys an update of kind of what we're looking at when we're talking about the COVID vaccine. And now I want to go ahead and answer some of your excellent questions. If I get COVID between the first and second shot, can I still get the second shot? The answer is yes. You can get the second shot as soon as you are recovered from your COVID. There is no known length of time that you can delay before getting the second shot. So you don't have to worry about being too long in between shots. You can still get the second shot after you recover from COVID. Is it okay to take the vaccine with underlying conditions such as rheumatoid arthritis, high blood pressure, and being over the age of 65? The answer is yes. There are very few known underlying conditions that could predispose you to not being able to take the COVID vaccine. Rheumatoid arthritis, high blood pressure, asthma, diabetes, all of these are not underlying conditions that would prevent you from getting the COVID vaccine. If you are really concerned, I would definitely speak with your primary care doctor or whoever manages your condition. And you can always reach out and ask me as well, because I'll be happy to look that up for you. If someone tests positive but is asymptomatic, can they still be contagious, or are they just carriers? The answer is that if someone tests positive but is asymptomatic, they can still be contagious. In fact, that is one of the ways we think COVID is spreading so widely, is through asymptomatic carriers. So if you test positive, you have to assume that you can carry it and pass it on to others. I had been advised by my pulmonologist to not ever get the flu vaccine after my first time administered ended up in the ER and hospitalized for about 2 weeks. Is it safe for me to receive the COVID vaccine if I have chronic asthma? The answer is that the flu vaccine and the COVID vaccine are different. So people who can't get the flu vaccine for various reasons should still be able to get the COVID vaccine, including people with Guillain-Barré, which I looked up recently for somebody. Again, you may want to ask your pulmonologist because there might be more to the story that I don't know. So I would maybe talk to them. But with chronic asthma or even with reactions to other vaccines, people are still being advised to get the COVID vaccine. If receiving the first or second dose and you start having any symptoms, are you contagious in any other ways? For example, fever and body aches. So this is kind of what I was talking about in the introduction. Things like fever, symptoms such as fever, body aches, headaches, lymph node swelling, all of that is generally a sign that your immune system is working. So it doesn't necessarily mean that you have a symptom of the disease, but that your immune system is creating antibodies. The CDC says that fever is kind of a soft call because we always have to worry about fever, but if it goes away within 48 hours of the shot, they say that it's likely due to the shot. If it doesn't go away within 48 hours, they say go ahead and get tested for COVID. Other symptoms like cough, shortness of breath, and loss of taste and smell are not side effects of the vaccine. So if you do experience those after any shot, you actually need to assume that you contracted COVID at some point and go ahead and get tested. Things like sore throat, headaches, those are kind of those soft symptoms as well, where you would just kind of watch it for 48 hours. But if you are concerned, please just reach out and we'll see what we can say. I received the vaccine, but I was a little concerned to find out that it's not FDA approved. Why is the vaccine not FDA approved? The answer is that the vaccine actually is FDA approved for emergency use. It is under emergency use authorization. The FDA approval process has a lot of red flags, red tape, paperwork, and time that goes into it. And because of the urgency of this nature and the incredible vaccine trials that showed that it was really effective with minimal side effects, the FDA went ahead and cut through some of that red tape to get it emergently approved. It will likely go through the full FDA approval process very soon. Is it a law to get vaccinated? At the moment, it is not a law to get vaccinated. Is it true that the vaccine affects the aspect of any sexual activity for a certain amount of time? The answer at this point is, unfortunately, or fortunately, no. Is the second vaccine the same as the first? I've heard for a lot of patients, more severe side effects occurred after receiving the second vaccine. Is that because there's a difference from the first one? Great question. They are actually both the exact same vaccines, the exact dosages, it's all the same. The difference is that the first shot really kind of primes your immune system, and then the second shot is almost like a booster. So a lot of people are having more side effects after the second vaccine because their body is already creating that immune response based on the first vaccine. All right, I'm going to combine two questions here. Have the ingredients in the vaccine been used in other vaccines or commonly used in medications? And are all the ingredients available to make sure that we are not allergic to any of them? The answer to both questions, or all the questions, is yes. There are no new ingredients in this vaccine that have not been used in other vaccines and other medications. And all the ingredients to all the vaccines are listed on the CDC website. So you should be able to go online, look at all of the ingredients to find out if you've ever had a reaction or an allergy to any of those ingredients. Will we still be able to get our spouse a vaccine? I'm trying to get a vaccine for my husband and not able to get an appointment. Thanks. The answer is yes. We should be able to get your spouse a vaccine. We are working on getting more vaccines, and then the city is also offering vaccines. It is all being done according to the tier system. So if you find out what tier your spouse is in, you should be able to get them a vaccine based on that tier. What is the difference between the Pfizer and the Moderna vaccines? The differences are very small, just a few of the ways that they store and kind of transport the vaccines, the ingredients in the vaccine are just slightly different. The mechanism of action between the vaccines is very similar, and it's almost exactly the same. The particular individual ingredients, like I said before, you can go up on the CDC website and look them up and see if there's any one particular ingredient in either vaccine that you know you have a reaction to. So thank you all for your questions. They were really excellent. Hopefully this has provided some answers to you all. And if you have any other questions, just send me an email and I'll go ahead and answer them as best I can. Just remember, it can be uncomfortable to have side effects from a vaccine, but the alternative to me was to actually get COVID itself because numbers in our community are going up. So I chose to go with the route that I thought would be the least risky for me and for my family and for our community, because I know we are all trying to get back to normal, and this is one great way to get it going. So thank you again. Reach out with any other questions, and hopefully you've gotten some answers today.